So radiotherapy for me was Monday to Friday, every Monday to Friday. So the positioning, every time my positioning was very strict. So sometimes it actually take more time being positioned on the radiotherapy table. So where the tattoos were, that's where the rays were supposed to sort of cross each other, because the radiotherapy is more about the rays focusing on the specific area where the cancer is located, where the cancer tumor or tumors were. So that's what radiotherapy was all about. So I'd get in, would register our names, all the cancer patients, sit around, knit. There was always something to knit, or, just, would just chat with each other. When it was my turn, I'd get in, lie on my back, the radiographers, 3 or 4 of them, making sure that, the rays are specifically at the little tattoos that I had, because they're focusing on one area. So for 15 to 20 minutes, the radiotherapy machine would go around me. So it would, it was directly above me. There's a funny sound, buzzing sound. It would do for a few seconds, and then it goes to the machine goes round to the one side, to my side, focusing on the hip, and then it would go under me, and then come back and go again to the other side. So that was just for 15, 20 minutes. So that was the radiotherapy part. During the radiotherapy, within the room, a very cold room, I must say, I didn't feel anything when the machine would go around me every time. It's not a painful process. But in layman's terms, how the doctors explained this to me was radiotherapy is like an extreme sunburn. So only about a week into radiotherapy, I started having blisters all over, because of the radiotherapy effects. And so that's what I had to go through with them. So those blisters had to be looked into. The whole area for radiotherapy to work, it's not supposed to have moisture. So I had to use specific ointments on the wounds, and the ointments were they would sting, and they were itchy, and these are blisters. And remember, I also had that operation, the surgery, that determined through that where the biopsy came from. So even at that wound, right, I'd have the wound, and then through that wound there were blisters that would come through. I wish I could draw a diagram to just show you how terrible it was. So while radiotherapy was going on, I also had to start on chemotherapy. So chemotherapy, basically, it's injections, or through injections or tablets. So this was oral. So chemotherapy would, it would go through the whole body, like what happens with any tablets or any capsules, right? So what happens with chemotherapy, it's also looking at the cancer cells. The basis, or the purpose of it is to target cancer cells and kill the cancer cells. But what happens with chemotherapy, and why it's so tough on the body, is that even the healthy cells are caught in the crossfire, where sometimes healthy cells are equally destroyed as the chemotherapy is trying to attack the cancer cells. So that's what was happening with my treatment.
So as time went on, you were always in and out of hospital, and how long did it take for you to go through all those, you know?
So in terms of radiotherapy, I needed was it 40 days, 40 sessions of radiotherapy. So sometimes to be honest, sometimes I would call my doctor and just say, the pain is too much. I can't get up. I can't go for radiotherapy today. And so within that, maybe if I miss a day, he'd have to, call me, talk to me sternly, and counsel me about, how tough cancer treatment was. And sometimes would just be on the phone. Sometimes I wanted to give up, because chemotherapy as well, it was very tough on me. I lost a lot of weight from a nice 65 kg. I was down to 45 point something kilograms. And sometimes I hated looking at myself in the mirror without my hair. I actually cut off my hair because I was anxious about waking up and seeing chunks of hair falling out. So I didn't want that experience. I cut my hair. So in essence, it took 6 months. It was a treatment that spanned around 6 months.
Now, where are you today? in terms of treatment.
Yes.
So what is going on right now in terms of treatment?
Okay, so after I finished radiotherapy in 2020. Chemotherapy as well. Chemotherapy I finished a few months later. And so what was happening from there, I have had to go through scans every 3 months. But within those 3 months, I also go for regular checkups with my doctor. They're looking at my iron levels, my blood count, just to check if, there is no recurrence of cancer, because there is always a risk after cancer treatment, especially in the first 2 years of remission, for the cancer to come back. So my doctors are keeping a close just to see if. So post chemotherapy and radiotherapy, I've had to start what is called hormone replacement therapy. So after radiotherapy, or the side effects of cancer treatment, some of them are long-term, some are short-term, and some of them are for life. So one of the side effects that I've had to contend with is premature menopause. So because of radiotherapy and the focus of the rays, what do they call them? Those rays. um, it was also, it then affected my ovaries and my reproductive system, meaning that I always joke and say that radiotherapy fried my eggs. So because of that, I've gone through premature menopause. So now because of that, my body has been in some kind of shock because of the side effects of both chemotherapy and radiotherapy.